Hello, I'm Kevin Fernando, a GP working near Edinburgh in Scotland and content advisor for Medscape Global and UK. Welcome to our podcast, Medical Mentor, a bite-sized regular chat for all of us working in primary care. Podcasts will cover hot topics, practice pearls and hacks, as well as pitfalls to avoid, helping make our lives a little bit easier in primary care, but ultimately to help improve the lives of our patients.
In this podcast, I'm going to talk about the importance of recognizing and managing health anxiety in primary care. Lao Tzu, the legendary Chinese philosopher, famously said, "If you are depressed, you are living in the past. If you are anxious, living in the future." While people living with low mood or depression are frequently consumed with guilt about their perceived failings, those with anxiety are more likely to be consumed with worries about what might go wrong for them or their loved ones, be it their safety, their work, or indeed their health. I'm sure all of us in primary care can immediately recall patients of ours who continue to experience anxiety and worry about their health despite reassuring investigations and referrals to our secondary care colleagues. Normal concern about health can sometimes turn into this persistent and excessive fear of being seriously unwell. The DSM 5 classifies this as somatic symptom disorder and illness anxiety disorder. Illness anxiety disorder focuses on the fear of illness itself, while somatic symptom disorder focuses on the experience and response to physical symptoms. Health anxiety is a core feature of both illness anxiety disorder and somatic symptom disorder, and is the preferred terminology in daily clinical practice. It's estimated health anxiety affects around 5% of the general population, and this under-recognized condition drives significant long-term morbidity and sickness absence in the community. Individuals living with health anxiety undergo more investigations and referrals and use more health resources than those without health anxiety. Importantly, health anxiety often coexists alongside other established physical health conditions and is often missed because of this. An excellent and pragmatic article on health anxiety was published in the British Medical Journal during 2019 and provided some useful clinical pearls and pitfalls to avoid when suspecting health anxiety in primary care. Useful clues highlighted in this article that might point towards health anxiety include worry about health that quickly and repeatedly resurfaces after reassurance. For example, after a normal investigation, such as a colonoscopy. Another useful clue is evidence of frequent consultations with healthcare providers, such as family doctors and community pharmacists. Additionally, another clue are health worries that lead to substantial functional impairment, such as self neglect or agoraphobia. This can also point towards health anxiety. And finally, cyberchondria is a useful clue, or excessive online searching for health related information. Cyberchondria fuels health anxiety and spreads pathogenic ideas. Cyberchondria is often made worse by what we call confirmation bias. Confirmation bias is when we already have a result or a belief in our minds. For example, my headache is caused by a brain tumor. So we only look for the information or evidence that confirms this idea or belief while neglecting the evidence that contradicts it. For example, a tension type headache caused by ongoing stress at work. Now, there are screening tools to help us identify health anxiety in primary care, such as the Health Anxiety Inventory. However, these can be somewhat clunky and time consuming to use in a primary care consultation. Some useful questions to ask individuals with suspected health anxiety were also posed in the BMJ article. For example, have you been worrying a lot about this? Do you tend to worry about your health in general? Do you think that you've not been taken seriously by clinicians in the past? Someone suffering with health anxiety is likely to answer yes to at least one of these questions. Additionally, ask what is the worst thing you could fear could happen. This can really help us understand what is driving their fear. Or ask when did you start to worry more about your health? This might help identify triggers. Triggers might be a serious disease they or a family member were diagnosed with, or sadly, the death of a loved one, or other external stressors. Also asking, how has this worry about your health affected your work, social, and family life? A key feature of pathological health anxiety is that it leads to excessive checking and health monitoring, which can lead to significant morbidity and suffering, a real impact on quality of life. We should also be aware that many people with health anxiety also have a comorbid mental health problem. So we should take the time to explore for generalized anxiety disorder, obsessive compulsive disorder, panic disorder, medically unexplained symptoms, and also substance misuse. So, how do we manage health anxiety in primary care? Well, a key message for us all working in primary care is that reassurance and investigation of symptoms is ineffective. In fact, reassurance is like an addictive drug. Individuals with health anxiety get immediate relief from that reassurance, but this quickly wears off, sometimes even by the end of the consultation. So instead, the authors of the BMJ article suggest we consider saying, it is clear that you're worried about your health. We have ways of helping this, and this will not affect any other treatment you are receiving. Now, this latter clause is particularly important as individuals with health anxiety sometimes feel if they admit to health anxiety, their other medical problems might be neglected. We also need to validate individuals' symptoms. We need to acknowledge that we believe that their symptoms are real and genuinely experienced. This, of course, will increase motivation and engagement with any treatment plan. We also need to provide an alternative explanation for their symptoms. This can also be very helpful, explaining to individuals with health anxiety that a range of sensations can be experienced in health anxiety, and these are actually symptoms of anxiety rather than underlying disease. So, in terms of treatment, first line treatment remains CBT, cognitive behavioral therapy. CBT is an effective treatment leading to reduced anxiety levels, improved overall functioning, and reduced frequent attendance in healthcare settings. CBT also improves generalized anxiety and depressive symptoms, and benefits are actually seen for at least 5 years, as evidenced by the CHAMP randomized control trial. However, acceptability of CBT as a treatment may be limited for some individuals who consider their issues to be more physical rather than psychological. We can consider pharmacological treatments. We can consider SSRI antidepressants in those with debilitating health anxiety and who decline talking therapies. Overall, fluoxetine and paroxetine are more effective than placebo, but actually, there is a low quality evidence base for all pharmacological therapies for health anxiety. If we do consider medication, we should consider starting medication at a very low, possibly even subtherapeutic dose, and build up very gradually, as individuals can be very sensitive to the adverse effects of medication, which of course will exacerbate anxiety and worry. Additionally, there also may be an increased risk of the paradoxical anxiogenic response we sometimes see with the SSRI class during the early days of treatment. We're also reminded to check understanding with the individual living with health anxiety, as misinterpretation is also a core feature of health anxiety, both of bodily sensations, but also of health information. And finally, with regards to follow up, ideally one clinician should take the lead with regular appointments planned in advance for continuity of care.
So thank you all for listening. I hope you found this podcast helpful. Please do listen to our future Medical Mentor podcast, which will be available on all major platforms. Follow me on X, formerly Twitter, at Dr. Kevin Fernando, or email me on kfernando@webmd.net if you have any questions, comments, or ideas for future podcasts. Thank you again for listening.